Hey, I'm Dr. Gardner, and tonight I wanted to talk about cranial cruciate ligament rupture and tears in dogs. If you have a dog that is struggling to rise, or they're really lame in one of their hind limbs, or they do what's a sloppy sit, where one leg is out to the side when they sit down, those are signs to not be ignored because it could mean that your dog has ruptured their cranial cruciate ligament. The cranial cruciate ligament is a ligament of the stifle joint, so that is their knee, and it connects the femur and the tibia along with a bunch of other ligaments. And so it serves a very important purpose. It prevents rotation of that joint or hyperextension of that joint. And so when it's torn, it really causes a lot of instability, and it can also cause a lot of pain. And similar to us, when we get ACL tears, there's also frequently meniscal damage. The meniscus is like a little cushion in the joint, and when there's tears or damage to that, that can also cause a lot of problems. CCL tears can happen acutely if they're out running around, or they can happen over a period of time. They are more prevalent in large breed dogs, but absolutely definitely affect small breed as well. And they are more common in animals that are spayed or neutered early on. They also tend to be a bit more common in weekend warrior dogs, the ones that kind of sit around and then go out on the weekends and get crazy. Lucky for us, diagnosis is usually able to be done on the physical exam alone. So there's a couple of techniques that veterinarians will use to diagnose it when we palpate that joint and also when we watch them move around. And certainly there can be more obvious signs like swelling and lameness and sitting oddly. If you elect to move forward with surgery, which is one option, then radiographs are definitely required. They'll need to x-ray the joint, and typically you'll want to do chest x-rays as well. There's two primary surgeries that are very successful, the TTA and the TPLO. Surgery is usually very successful with great outcomes, and it also dramatically reduces the amount of osteoarthritis that occurs after this injury. There are also non-surgical options that typically involves physical therapy and a pain management plan, which usually is anti-inflammatories of some kind. And I'd like to recommend joint supplements as well. So if you notice at home that your dog is having a pelvic limb lameness, could be a CCL tear or rupture, I would be very interested to hear from any of you who have gone through this process, particularly those who have elected to move forward with medical management and what you've found to be helpful in the outcome. So I hope that you found this helpful. I hope you will like and subscribe, and I will see you next time.